Our veins normally have a main focus, and that is to help to return the blood to our heart. Unfortunately, the veins have a problem because the blood likes to fall due to gravity. Veins have valves in them that point towards the patient's head. Those valves normally should close to prevent the blood going downstream. When the vein walls weaken and the veins distend, the vein valves can no longer reach each other, and because of that, the blood, due to gravity, falls down towards the patient's feet. And the normal tributaries that are in the patient's calf that normally join together to form larger and larger streams which eventually drain towards the heart, those tributaries become engorged and form varicose veins. Spider veins actually occur in about 50% of women over the age of 50. Men get them too. But varicose veins are also extremely common, and the varicose veins are the big bulgy veins that stick out of the leg, and they look like a rope or sometimes like a bag of worms, whereas the spider veins truly look like a spider web sticking out typically on the side of the thigh. You should know that sometimes the patients don't have any symptoms at all and may simply have spider veins or varicose veins, and they may simply be a cosmetic problem. However, there are other patients who have pain, aching pain, cramping, burning, throbbing, leg swelling, darkening of the skin called stasis changes, lipodermatosclerosis, which are very bad changes in the lower legs where the legs get very dark, and even open wounds called ulcers. It is very possible that one may have a vein problem without any visible evidence. Sometimes the patients may simply have cramping pain or throbbing or restless legs. Sometimes there may just be some darkening of the skin and the patient has no idea that they actually have an underlying vein problem. If a patient thinks they have a vein problem, they really should see a vein expert. Now, how do you know who is a vein expert? Well, that's a very good question. The answer is it should be someone who dedicates their practice to the treatment of venous disease. And there is a relatively new specialty called phlebology. Ultrasound is critical, not only for diagnosis, but for treatment. Why? Because patients are not all the same. Everyone has their own unique anatomy. You have to understand which vein is causing the problem in order to provide the adequate treatment. If you don't know the patient's anatomy, you might treat the wrong vein. The great thing about ultrasound is you can actually see live blood flow. So you can see the direction the blood is flowing. And it's very important to determine which is the vein that has the blood going the wrong direction. Not only that, but all of the treatments which we do today are ultrasound guided. So you can imagine if you are able to physically scan a patient while you're doing the procedure, you can be very precise and you can get into the tiniest of veins if you can do that, as opposed to, say, having a technologist who is scanning the patient while you're trying to do something and you're both trying to figure out where each other are. Does that make sense? Yeah. State-of-the-art vein treatment requires ultrasound imaging to visualize the veins and also to watch the devices as you advance them into the vein. So you can imagine if you have an ultrasound probe sending out a beam of light or ultrasound waves, it's coming out in a single two-dimensional plane, like a piece of paper, into the patient's body. At the same time, you're advancing a device into the vein from a different angle. The human brain can correlate the direction that each one is going so that one can precisely advance the device into the vein while you're imaging. So if you're using both of your hands simultaneously to do it, you can get into the tiniest of veins, as opposed to, say, some vein practices where there may be a tech scanning the patient and the person who's trying to do the procedure is trying to communicate with the tech as to where exactly the device is going. It's not as precise. When patients ignore or put off vein-related problems, they may not have any complications. However, there is always the risk that they may develop a problem, such as a clot in the varicose vein, which is called a superficial thrombophlebitis. And that can lead to a dangerous clot, such as a DVT, or deep venous thrombosis. Other issues that patients may have are an open wound on the leg called an ulcer, or a venous stasis ulcer, which can truly be debilitating. Some patients come in for aesthetic reasons. They just don't like the way that their veins look. And it can be a real tiny spider vein, or it could be a very large varicose vein. So that's one end of the spectrum, the patients who just have a problem that they don't like the way it looks. It's an aesthetic issue. There are other patients who truly have a medical problem, where they have symptoms. They may have pain, they may have throbbing, aching, cramping, burning. They may have leg swelling. They may have darkening of their skin or an open venous stasis ulcer. Patients often delay treatment because they have apprehension, either about the comfort of the procedure, downtime, perhaps even the cost of the procedure. The truth is that most state-of-the-art treatment for vein disease or vein problems is very comfortable, has almost no downtime, and is extremely affordable. And in fact, the treatments for most of the vein problems are covered by insurance.